On the Health Watch today, virus hitting kids hard that we've been reporting about. We told you earlier in the newscast, hundreds of children in about a dozen states so far have been put in the hospital with something called enterovirus 68. It is similar to a cold. The difference, though, is this can be much more dangerous. Joining me now, Dr. Michael Siebert with Children's Medical Center. So let's talk about this thing. So it kind of disguises itself. It sounds like the normal cold, but what takes the symptoms over the top for the parent to say, wait a second, we might have a little issue here?
Well, it's a matter of knowing your child, and if that child is having difficulty breathing, then they're going to need medical attention. For younger children, if they're having difficulty keeping themselves hydrated, which often is accompanied when children have respiratory illnesses as young kids, and those are the main signals.
Yeah, so it presents itself, as we've reported, with cold-like symptoms, but you're saying the one key is going to be this breathing, and we heard the word in the last 24 hours, wheezing.
Yes.
So that's something audible that we as a parent will hear. That's much different than just having a little stuffed up nose.
Wheezing is down in the lungs as opposed to up in the nose, and sometimes a parent may hear that. Sometimes they may just notice that their child is struggling for breath, and they may need to have a doctor examine them to detect that wheezing.
And that's the other equation there, doctor, is at what point do I as a parent go, well, based on reports, this may be more than a common cold. I guess my question is, what are we going to do to keep the kids safe, but at the same time avoid every parent in the Metroplex rushing their children to the doctor because they hear something that might sound somewhat out of the ordinary? Because we don't want to overtax the system at the same time.
That's a good point. Many patients with this virus probably do not end up developing a severe illness and probably do not eventually need to go to the emergency room or hospital. So it's really only when that child seems to have difficulties with breathing or drinking that you can't take care of at home that you would need to go to the hospital.
All right. And last question, yes or no, some of the health experts we've heard from in the last 24 hours say it's only a matter of time till we see this in North Texas based on other places around the country. Do you agree with that?
I think that's likely. We can't say for sure, but I think it's likely.
All right. So the deep, the heavy breathing, the tough to get your breath, and the wheezing is the real key to watch out for.
Yes.
All right. Dr. Michael Siebert, Children's Medical Center, thanks.